Sudanese civilians have suffered horrendous levels of violence, Médecins Sans Frontières said on Monday, during more than a year of war. They have, the medical aid group said, faced repeated attacks, abuse and exploitation by both sides. And the physical and mental wounds have been exacerbated, according to an MSF report, by the collapse of Sudan's healthcare system and a lack of international humanitarian response. Vicky Hawkins is General Director for MSF Netherlands.
Since May, MSF-supported hospitals or premises have been hit by shelling or airstrikes at least 5 times in Omdurman, Khartoum and El Fasher, leading to the deaths of health workers and patients, including children.
Hawkins said sexual and gender-based violence is pervasive,
but critically underreported due to the stigma, silence for fear of retaliation, and the void of services and confidential spaces.
Thousands of war wounded have been treated at facilities MSF supports, Hawkins said, including for gunshot, shrapnel and stab wounds. War erupted in April 2023 between the army and the paramilitary Rapid Support Forces. It was triggered by a plan to integrate the army and the paramilitary forces as a part of a transition to free elections following the overthrow of long-ruling autocrat Omar al-Bashir in 2019. There is no accurate data on how many have been killed, but death toll estimates run into the tens of thousands. The MSF report accused the warring parties of a blatant disregard for human life and international law. Neither side could be immediately reached for comment. MSF called on the two sides to cease attacks on residential areas, allow safe passage, and protect infrastructure from further destruction and looting. It also urged them to stop what it said were targeted forms of violence and abuse, including ethnic and sexual violence.